Understanding anaphylaxis and how to respond. Anaphylaxis is a severe allergic reaction that can be life-threatening. It is important to understand anaphylaxis and know how to respond to it. This article will discuss what anaphylaxis is, the signs and symptoms, common triggers, and how to respond if someone is experiencing anaphylaxis. What is anaphylaxis? Anaphylaxis is a severe, potentially life-threatening allergic reaction that affects multiple organ systems. It can occur within seconds or minutes of exposure to an allergen. Anaphylaxis is a medical emergency and requires immediate treatment. Without prompt treatment, it can be fatal. Signs and symptoms of anaphylaxis. The signs and symptoms of anaphylaxis can vary from person to person. They may include 1. Skin reactions, hives, itching, and swelling of the skin, lips, tongue, or throat. 2. Respiratory system, difficulty breathing, wheezing, and shortness of breath. 3. Cardiovascular system, low blood pressure, fast or weak pulse, and fainting. 4. Gastrointestinal system, nausea, vomiting, and diarrhea. 5. Nervous system, dizziness, confusion, and loss of consciousness. Common triggers of anaphylaxis. Anaphylaxis can be triggered by a variety of allergens, including 1. Foods, peanuts, tree nuts, shellfish, fish, milk, eggs, and wheat. 2. Insect stings, bees, wasps, yellow jackets, hornets, and fire ants. 3. Medications, antibiotics, aspirin, and non-steroidal anti-inflammatory drugs, NSAIDs. 4. Latex, gloves, balloons, and other products made from natural rubber latex. How to respond to anaphylaxis. If you or someone you know is experiencing anaphylaxis, it is important to respond quickly. Here are the steps you should take. 1. Call emergency number. Anaphylaxis is a medical emergency that requires immediate attention. 2. Administer epinephrine. Epinephrine is the first-line treatment for anaphylaxis. If the person has an epinephrine auto-injector, such as an EpiPen, use it immediately. Inject the epinephrine into the outer thigh muscle. 3. Monitor the person's breathing and pulse. If the person is having difficulty breathing, assist them by helping them sit up and lean forward. If the person has stopped breathing, start CPR immediately. 4. Give additional medications. If the person has other medications, such as antihistamines or corticosteroids, give them as directed by a doctor or emergency medical personnel. 5. Stay with the person until help arrives. Anaphylaxis can be a frightening experience, and the person may be scared or confused. Stay with them and offer reassurance until help arrives. In conclusion, anaphylaxis is a severe allergic reaction that can be life-threatening. Knowing the signs and symptoms, common triggers, and how to respond to anaphylaxis can help save lives. If you or someone you know is experiencing anaphylaxis, call an emergency number immediately for help assistance guidance. Stay with the person and offer reassurance until help arrives. Remember, anaphylaxis is a medical emergency that requires prompt treatment. Understanding anaphylaxis and how to respond. Anaphylaxis is a severe allergic reaction that can be life-threatening. It is important to understand anaphylaxis and know how to respond to it. This article will discuss what anaphylaxis is, the signs and symptoms, common triggers, and how to respond if someone is experiencing anaphylaxis. What is anaphylaxis? Anaphylaxis is a severe, potentially life-threatening allergic reaction.